Today we're going to talk about dry lips from isotretinoin or Accutane. Welcome, I'm Dr. Kolsky. I'm the founder and medical director of the Advanced Acne Institute, and we are a dermatology practice that specializes only in acne. That's all we do, so we're very unique in that regard. We like to share insights because we have that unique experience. And today we're going to talk about dry lips from isotretinoin or Accutane. Dry lips. Everyone who takes Accutane essentially develops dry lips. It's one of the areas that become the most dry on this medication. The way the medicine works, it dries up the oil glands to the extent that you start to feel it, and mostly feel it in your lips and in the face. You can also feel it in the rest of your body, but most people don't have too much in the way of issues with the rest of the body, although we do have times when they can develop eczema or dryness that becomes uncomfortable, and then they have to moisturize more. But that's not very common. Usually people who do have a history of eczema have to be a little bit more careful because they can have a flare-up when their skin gets very dry with Accutane. The lips mostly can be controlled well with using topical lip balm, and we like to use Aquaphor ointment. That's one that helps us a lot. And you have to reapply it frequently. And usually that's enough to keep everything under control. Rarely do people have, in our practice, rarely do they have lips that get very dry and uncomfortable. Occasionally we might use prescription medicine to help calm them down, but that's very rare. The vast majority of patients are well controlled using their regular moisturizing techniques, and they get through the treatment just fine. So yes, dryness of the lips is a very common problem. It can usually be very well controlled, and we usually don't have to interrupt the treatment because of that.